Is it ethical to compensate kidney donors? Compensating donors is a way to recognize donors' profound act of generosity, reduce healthcare costs, and save tens of thousands of lives. This is our stark choice. Allow 100,000 Americans to die over the next decade, or save them by compensating kidney donors for their selfless act of surgery to save a stranger's life. The End Kidney Deaths Act offers a solution to end the kidney shortage. For 20 years, the rate of living kidney donations has stagnated. As a result, 25 Americans on the waiting list die every day, deaths that are preventable. To save these lives, we must dramatically increase the number of people willing and able to donate. Currently, only 2% of willing donors proceed to donation, primarily due to medical disqualifications. For those who do qualify, donating a kidney is remarkably safe. Studies show that kidney donors tend to live longer than the general population. But the process is also demanding. It requires time, physical endurance, and emotional strength. Compensating donors for their sacrifice is not only ethical, it's essential to save lives. How will compensation of kidney donors impact low-income Americans? Some wonder if compensating kidney donors might unfairly affect low-income individuals. But today, the reality is that high-income Americans are 3 times more likely to receive a kidney transplant than low-income Americans. Compensating donors will save lives across all income levels. We can also draw a parallel to surrogate mothers. Are surrogate mothers predominantly low income? No, they represent diverse economic backgrounds. The same would hold true for compensated kidney donors. Compensation with a tax credit honors the courage of donors who save the lives of strangers. Here's another truth. 1% of all tax revenue currently funds kidney dialysis, a costly treatment that only sustains life rather than restoring health. Compensating kidney donors would not only save up to 100,000 American lives in the next decade, it would also reduce healthcare costs by as much as $37 billion. Failing to pass the End Kidney Deaths Act means continuing to lose 25 Americans every day to a solvable crisis. They are dying not because their condition is untreatable, but because of the kidney shortage. Passing the End Kidney Deaths Act isn't just an ethical decision. It's a practical solution to one of the most pressing public health challenges in America. 100,000 Americans are counting on us to get the End Kidney Deaths Act to the finish line. The choice is clear, and 2025 is our year. Let's contact Congress now to pass the End Kidney Deaths Act and ensure a future where no one dies while waiting for a kidney. Because saving lives is not only ethical, it's our responsibility.